Good evening, everyone, and welcome to this webinar, a deep dive into implementing teledentistry into a dental practice. My name is Andrew Zale, and I work for the Hawaii State Department of Health. Before I get started, I do want to thank the Hawaii Oral Health Coalition for sponsoring and organizing this webinar, and thanking Dr. Paul Glassman for presenting. Before I get started, I wanted to go over a few housekeeping items. Number one, during the presentation, you will have an opportunity to submit questions for this presentation. If you can just click on the question and answer icon on the control panel, we can review the questions at the end of the presentation and answer it. Also, during this presentation, we will be conducting some poll questions, and your participation is also appreciated. At the end of the presentation and within a week, we will be emailing everyone that participated their certificate of continuing education confirmation. So today we're pleased to welcome Dr. Paul Glassman, a very special guest from the state of California. Before I get started, we'd like to really express our appreciation and special recognition to Dr. Glassman for his significant contributions to implementing and developing the virtual dental home pilot project in the state of Hawaii. Dr. Glassman is Associate Dean for the Research and Community Engagement at the College of Dental Medicine at the California North State University in Elk Grove, California. He is also a Professor Emeritus at the University of Pacific Arthur A. Digoni School of Dentistry, which is located in San Francisco, California. Dr. Glassman has served on many national panels nationally and is a nationally recognized expert on telehealth and teledentistry. And he also was included in the panels regarding the Institute of Medicine's Committee on Oral Health Access to Services. Dr. Glassman is a pioneer and the national innovator for promoting the virtual dental home and also telehealth connected teams. With that said, it's an honor to introduce Dr. Paul Glassman. Thank you.
Thank you, Andrew. Let me see if I can start my video here so you can see me. Yes, trying to do my best to fit into why I wish I was there physically, so I'm sorry that I'm doing this over video, but I can pretend anyway with the background picture and the aloha shirt. But it's a pleasure to be able to talk with some of you again. I did a webinar about a month ago for the Oral Health Coalition, and when we were looking at the registration list for this session versus the last one, it looked like maybe 30–40% of you were on the previous one, so which means the majority were not, which means that I'm going to try to cover some ground, sort of level setting for the people who were not on the previous one so that we can all be in the same place. So something will be a little review if you were here a month ago or joined me a month ago, but then from there we will move on to talking about some other things. So with that, you should be looking at a slide that was the Oral Health Coalition slide, and now a title slide from me that says Teledentistry in the Era of COVID-19 and Beyond. I'm just going to put up my slide with disclosures, just that talks about my consulting arrangements. That's a lot of what I'm doing. As you heard from Dr. Seo, I'm spending part-time now helping start a new dental school in California, just south of Sacramento, California North State University, and then I'm doing a lot of consulting for people who are interested in teledentistry. In fact, it's been pretty astounding, the interest in teledentistry now compared to when I first started working in this area, which was close to 15 years ago, and been working with Dr. Seo and others of you in Hawaii now for almost a decade. And even during most of that time, it was kind of a little niche thing off to the side, but now there's tremendous interest in teledentistry. So I do want to acknowledge some of the partners that I've been working with, had the privilege to work with over the last really almost a decade. Now, also already mentioned Dr. Seo at the Hawaii State Department of Health, the West Hawaii Community Health Center, with a number of different people there, Hui no Ke'olopono, and various people at that health center on Maui, and then funding, which we've had from the Hawaii Dental Service and HMSA Foundation. This was a mayor's proclamation about teledentistry, sort of celebrating the impact that teledentistry had on the people in Maui, happened last year. And I think maybe that's symbolic of the fact that some of the idea of being able to bring care to where people are, as opposed to them having to go to a specific office or clinic, is really starting to catch on, and people are realizing the number one, tremendous barriers that some people face in getting care otherwise, and then how being able to reach out and bring care to where people are could actually really make a difference. So with that, let me just do a little bit of background, just a bit of that before I get into some uses of teledentistry. So first of all, just to point out the fact that we have a lot of different changes in our healthcare system that are beginning to take place. This is the director of the California Department of Public Health, a slide from a presentation she did a couple of years ago, just talking about the changes in the healthcare system in general in our country, with more of a focus on health than we've ever had and less focus on healthcare. I hope the difference between health and healthcare is obvious. That there has been an emphasis in the past on late stage repair disease. That's where most of the money has gone, but now people are saying we should be spending more attention to what people call working upstream, which means social determinants of health, getting to people early, emphasizing prevention. Also recognizing we have a population that's getting more older and more complicated, and then thinking more about the community as a level of focus. So what's the health of our community, not just what the health is of the individual patient who sat in a dental chair today, are they healthier on the way out the door, but looking at the health of the communities. And then we have lots of ability to collect information using big data and pay attention to what's the value of all the services that are being provided. So a different framing of our healthcare systems than we've had in the past. Just one slide from a bit of data from the American Dental Association, just showing people in the United States. And of course, this is not the same in every state. It's not the same in every community. It's not the same in every office. But in general, most people in the United States are not getting dental care. You can see it's about less than, in this slide, half the children. It's a little over half the children right now. But this is a very low bar. This is just an annual dental visit. Means someone interacted with the dental care system once during the year, and less than that for seniors, and only about a third of working age adults. So most people in the United States are not getting dental care on a regular basis. And I know from data that some of you and Dr. Sayo have shared with me that, in fact, it's somewhat worse in Hawaii, the lack of fluoridation and the island geography, that there are lots of people in the Hawaiian Islands in the state of Hawaii who are actually not getting any kind of regular access to dental care. So when people think about how are we going to move from that situation to one where we have sort of more equitable distribution of care and a better health of the population, we're now sort of emphasizing these three things that come up in this slide. Part of moving forward is going to be increasing emphasis on health outcomes and how do you make people healthier and what's the health of the population. And lots of people are working now in the oral health industry on measuring that and seeing how we can provide better incentives for providers to pay attention more to the health of the population. The second one is delivery systems, which is the focus of today. How do we actually get to people who are not getting dental care? We're going to talk about one method of doing that, which is teledentistry. And then the third circle is, once you're with somebody who's not getting regular care, how can we make sure that we're using the very best prevention and behavior science so that when you're with someone, you're doing the things that are going to produce the most health at the lowest cost? So I just want to say a couple things about prevention and behavior science. That we have just some spectacular, I think most of dental folks in the call would understand. We have some spectacular things compared to when I was in dental school. So all these things about remineralizing, beginning decay, understanding the Riemann-Diemann cycle that teeth go through, caries arresting medications now with silver diamine fluoride, the ability to seal caries in place so you don't have to remove it all that stuff. The science is really rock solid about all that. And when I was in dental school, these couple teeth there with little brown divots in them, there was nothing you could do except take a drill and drill that stuff out and put a filling in. And the reason I'm showing this slide in the middle of this presentation about teledentistry is that all these things on this slide, remineralization, caries arresting medication, sealing caries, the title of the slide, the declining role for the dental drill, these are all things that can be used without the need for a dental drill, without the need for surgical interventions that the drill sort of symbolizes, without the need for a dental office, without the need for a dentist actually to be in person with the patient, all things that can be done using allied personnel that are working in community sites and in communication with the dentist who can help direct them over a telehealth system. So if you think about it this way, it's a very different world than the world that we were in, certainly in previous decades in the world I was in. I also want to just say something quickly about this slide, that we know the most important thing by far, that whether people have good oral health or not, is what they do by themselves every day. Now, it's easy to say that. It's very difficult to get people to adopt what I call mouth healthy habits. And we know some things about why people do change habits and why they adopt better both brushing and eating techniques. And it mostly has to do with the things on the slide. So people getting messages from their own trusted members of their community are more likely to change their behavior than people getting messages from a dentist or a hygienist. It's not that they don't think that we're smart and we have lots of good information. It's often that they think we don't understand their lives and how difficult their lives are, and so they tend to discount what we have to say. Although it's very helpful for people to get multiple messages. But the other thing that's very hard for dental professionals to do is to coach people to take small incremental changes. Why don't you just try this one small thing, and let me talk to you tomorrow and see how that went. And tomorrow, hey, that was great. You want to try one more thing. Why don't you try this? Because typically, for the people who have most of the disease, we're not in contact with them day after day after day. And so all this idea of ongoing reinforcement and coaching and suggesting small incremental behavior and peer support, this happens much better when the dental professionals are actually working with community organizations like Head Start and school and nursing homes and residential facilities. When the dental professionals are working with those organizations, we have a much better chance of being able to help people adopt healthy behaviors. All right, so now let's move on to kind of the main emphasis of tonight's presentation, which is delivery systems and really the focus on teledentistry. So as I said, I've been working with teledentistry for now close to 15 years. We started a project in California, which I'll tell you about in a minute, and has gained a lot of traction and notoriety around the country. But when we first started doing this, and even up until fairly recently, it was considered something sort of way off in a corner of the oral health industry. And now there's lots of people paying attention to it. When I look around what's happening now, I see that there are various companies that are springing up to do something related to teledentistry, and they fall into roughly the categories I've listed on this slide. So you have some people using teledentistry for basically just sort of advice and referral. This could be anything from, say, a dentist who has just decided, hey, I want to stay in touch with some of my patients. And let's see if this poll just popped up now, and that's a good reminder that I want to do this poll at the beginning. So let's do it right now. Maybe we take a second, and thank you, Mark. I forgot to ask you to do that. So maybe everyone can take a second. I'm assuming you're all seeing the poll, and just put down your thoughts about teledentistry sort of prior to the COVID era. So a couple months ago, I call that ancient times, which is back in January of this year, January, February, in ancient times. What were you thinking about teledentistry? So just go ahead and mark one of those four answers. You had not thought much about it. You thought about it, but hadn't really used it. Use it a little, or you use it a lot. So just click on, with your mouse, click on one of those answers, and then click the submit button. Give you another couple seconds to do that, and then I will just see what the results are. And Maki, you tell me if you are able to see them right away. Otherwise, we'll just keep on going on. So hopefully this is enough time for everyone to have submitted. So we can stop the poll now and go back to the presentation. So I was talking about the various ways teledentistry is being used, starting with just dentists by themselves using maybe something like Zoom, or maybe a little bit more sophisticated video conference system like DoxyMe. But basically they're doing advice and referral, and basically telling people to come into the office or referring someone to an office. There's a little bit more formal way to do that. Here's the results. So it looks like 44% hadn't really thought much about it, 31% had thought about it but not used it. So that's clearly the vast majority. 75% really hadn't used teledentistry at all. 16% used it a little bit, and 9% had used it a lot. So way over 80% or 90% of you who really not done much with teledentistry in the past. So, but the number of people joining this webinar also is another indication that there's increasing interest now. Thank you for doing the poll, Maka. All right, so then you have companies that are doing a more formal sort of call center approach, where they're advertising, talk to a dentist, and then the patient typically pays some money. They get onto a video call with a dentist. The dentist provides typically some advice and a referral to a bricks and mortar dental office. That has some benefit, but I'm not sure all that much, because it typically ends up with a referral to an office. There are some people doing more what I call limited on-site care, where they might bring some equipment with some staff into a school or a business or some other kind of community site, and they collect records, and the dentist reviews the records, maybe makes a diagnosis and a treatment plan, And they do some preventive work, but then anything more than that, they refer the patient to a bricks and mortar dental office, and they're kind of done with it. That's why I use the word limited. And then the final category is what I call full service care, which is what we've been piloting here in Hawaii on the Big Island and on Maui, which is the virtual dental home system, where they're actually doing similar to limited on-site care, where people are coming into, a team is coming into a community site like a school or Head Start center, and they're collecting diagnostic records, and the dentist is making a treatment plan. But the difference is that there's an integrated network where if they do need to go see a dentist, it's actually the dentist who did the treatment plan that they're going to see, which is a much better system as far as I'm concerned. So I've been involved in systems like this now for, as I said, 15 years. We've been started with this thing we call the virtual dental home. That was the idea of trying to provide all the services that people think about in the sort of the health home, medical home, dental home concept, but do it in the context of what I call a geographically distributed telehealth connected team. So different people in different places are working together. This is the community team, hygienist and assistant. They have portable equipment, so they can be in one place one day and a different place in another day. They're collecting a full set of digital records. So here they're taking radiographs. In this next slide, they're taking photographs. You can see a little picture of the tooth in the back. Everything you'd see in a fully populated electronic dental record system. So all the full images, charting, progress notes, health history, consent forms are all populated by the community team in the community. And I won't walk through this extensively, but this is where the community team is collecting the records. It's going up into a cloud-based electronic record system. The dentist is not on site, so the dentist is in their office, and maybe between patients or on a certain, at the end of a day or lunchtime, they get into the electronic record system. They make a diagnosis and treatment plan. They decide, does this person need to come and see a dentist, or can they have the things that need to be done by the hygienist and her assistant, his or her assistant in the community. So the dentist has an important role, but not necessarily in a role that's in person in the community site. In California, not quite there in Hawaii yet, but dental hygienists are allowed to place what are called interim therapeutic restoration. So in Hawaii, you certainly can place sealants, which are very important. In California, this small hole in the tooth, understanding the science of interim therapeutic restorations, the dental hygienist can now, with some training and supervision by the dentist over the telehealth system, can now keep that tooth from getting to be a bigger and bigger hole and a toothache for the child, and who's not getting regular care by placing an interim therapeutic restoration, which can now last many, many, many years. So put that tooth in a long-term holding pattern. So we tested out that whole concept in California in a 6-year demonstration in a bunch of different communities, and clearly showed we can make this idea of telehealth connected teams work. I won't read this whole slide in terms of the outcomes, but we found that most children, 2/3 of the children, everything they needed to have done could be done. And this was the dentist's decision. The dentist decided that there was no point in having that child come to see me. They don't need anything that I need to do. Everything that can be done in the community. And that was before we had silver diamine fluoride. So we're guessing about 80% now could actually be kept healthy. And that's really a pretty astounding difference if you think about that 80% of children could actually be kept healthy through this telehealth connected team, the dentist making the diagnosis and treatment plan, the community team actually on site with the patients and doing the things that the dentist tells them to do. But 80% being able to reduce the barriers of transportation and getting to an office is pretty big deal. So we did this in California in 2010, and now in 2020, I'm not even keeping up necessarily with this. So there's even more states, but you can see it's just spreading across the country. Some of the different colors are states I'm working with directly in consulting. Other ones are just things I'm talking to people or know about. But the basic idea is that we're moving towards a system, what I referred to here as a community-engaged oral health system. So no longer do we think of oral health as the dental office is the center of the oral health universe. Now we have a community system where the office has an important role for doing the more advanced surgical procedures, but a lot of the staying in touch with patients, increased number of patients can be engaged. So, dental offices can have maybe, 1.5 times, twice as many patients as they had before, because now they're engaging people who were never really coming to the office previously, but it's all in a community engaged system. And the way we're going to get there is through, we call these the golden rings now, thinking about the focus of care as the community outcomes, delivery systems, and prevention. So we were moving in that direction, and we were actually doing this very successful demonstration on the 2 islands in Hawaii. And then, of course, we took a little bit of a detour now with era of COVID. So what's happening now, I think, as most people realize, is that we have a lot of challenges. We have practices that are trying to figure out how do they stay in touch with their patients, during this time. Practices are beginning to reopen, but not fully yet, and certainly not going back to the way things were before. Probably will never go back to the way things were before. Practice trying to limit some of the amount of in-person care. It's getting more expensive with all the PPE, and do you even have the right amount of PPE? Those rules are still being figured out of what you need to do. I was listening to it earlier this afternoon. Some of you might have heard the CDC had a webinar on one of the current rules and regulations for dentistry, and they did preface it by the fact that it's certainly not all settled yet. There's a lot of new science being coming in about how to safely conduct dental care. So we'll see. But a couple of things are pretty clear. It's going to be more complicated. You have to use more PPE. It's going to be more expensive. You might not be able to have the same flow of patients through an office that you had before. A lot of people now, when the COVID era hit and we really had to, everyone was staying at home, thought about, well, let's just put some tools together. Let's maybe see if we can combine, maybe patients are going to email us there some photographs, and maybe we'll have an email conversation with them, or maybe get some low cost off the shelf product like Zoom. We'll use Zoom, or we'll use DoxyMe for video conference, and we'll use a Google form for them to sign consent, and we'll use something else for them to pay. And I think those are all fine examples of people responding to a situation that really had no choice but to try and do something to help patients and stay in touch with them. But what's becoming really clear is that this is not a short-term problem. We're going to be in this environment for a long period of time to come. Even what could be, who knows, 6 months, years, maybe years from now, when we have sort of full vaccination or herd immunity from the COVID virus, all this new attention towards respiratory pathogens and airborne pathogens is going to clearly dictate some new infection control and transmission control procedures that are going to make dental practice more complicated and more expensive. So now people are thinking about, well, maybe just putting together a few off-the-shelf things is not the best way to do it. Maybe we ought to think about more optimized systems where all the tools that we need are more integrated. And so that's what I'm going to spend the rest of the time today talking about, what these optimized systems look like. So, some components of a practice that's using an optimized system would be, having a way to notify patients that you have this option available, a plan for how you're going to use it, which we'll get into in a little bit, ability to provide advice and consultation and triage over the telehealth system. Hopefully some patients, maybe many patients, won't even need to come in. Maybe the advice and consultation will be enough, but certainly the triage for who actually needs to come into the office, and then to try to minimize the time they're in the office if they do need to come in. And of course, the important thing is to try to have all these things in some kind of secure record system. So you don't have, you did your consent over here, and you did your payment over there, and you did your video conference over there, and now you got a responsibility putting this all together in a secure and HIPAA compliant way, because the current relaxation on HIPAA guidelines is not going to last forever. So let me just walk quickly through this, a quick sort of flow diagram, which would be what's a system like this, how it might work. So you have patients notified. There's a patient portal, so patients either can register it themselves, or maybe they call the office and the office tells them about it, or the office helps them get registered, or the office actually calls the patient and tells them we have this system available, we can help be in touch with you. And the patient gets into the portal. By the way, the orange bars are the places that the office does, and the blue ones are what the patient does. So the patient can maybe upload photos into now a secure HIPAA compliant patient portal. They can select the kind of appointment they want, whether it's urgent or not, or providers can set up whatever kind of series of appointments they want. Pay if there's a co-payment or a payment that's due. Fill out the forms, including consent, and even in the optimized system, which we're going to talk about, schedule their own appointments for a video conference with the dentist. The office is notified when the patient puts records in, and then they get on this secure synchronous video conference with the dentist, where they can do again the advice. Maybe they end up with a prescription called into a pharmacy, or some offices are beginning to have people do sort of drive-by a dispensation of high-dose fluoride toothpaste or things like that. Maybe they just want to watch that situation. So let's come back to that. Let me just see you again in a couple of days. I want to make sure that swelling is going down, whatever it is. Or maybe they need to plan for an in-person visit. But the important thing here is this bottom one, which is that all of this leads to a permanent HIPAA compliant and secure record of the interactions that take place, which you don't have in other kinds of systems. Let's walk through that workflow from the viewpoint of a patient. So the patient is notified that they have this available. They register, they create their portal, they choose the level of response they want, enter their payment or insurance information, fill out whatever forms are needed, upload their photos or records or whatever, even type in some information, and then pick a schedule that meets their needs. From the provider's viewpoint, the provider is now using an optimized system, so they're notified when the patient has entered records. They can respond by message or chat to make sure the patient fills out all the records, or that someone in the office can check that. Then they end up at the time of the secure video conference being able to talk to the dentist, again, advice, consultation, triage, and then the dentist would try to do what they can to see if the patient can be helped without coming to the office. But if they do need to come in, then it can be a significantly different visit to the office. And what I mean by that is, from the provider viewpoint in the telehealth system, all of the appointments can be set up over the telehealth system. If they're going to come in to have some procedure done, all the consent forms can be filled out on the telehealth system. Signatures can be collected. Any explanation about what's going to go on, instructions, both pre and post-operative instructions, post-visit instructions, all that stuff can happen through a telehealth system. So you really can minimize the time the patient's in the office. They're not coming in, walking into the waiting room, walking up to the reception desk, filling out paperwork, touching the pen. Do you have to disinfect the pen, or do you have a whole box of disposable pens? And what do you do with the clipboard that they've fill out the form? All that stuff can be done ahead of time through a telehealth system. So many dental offices are now, as they're beginning to open up, are really not using their waiting room anymore. They have all this stuff done ahead of time. The patient can actually just wait outside, and when they are called in, there's no need to stop at the reception desk. They're actually walking right into the operatory. They already have signed consent. They know what's going to be done. Any conversation that takes place has already taken place. They sit down, have what needs to be done, and then they're out of there. And then the follow-up can all take place through a teledentistry system. So the optimized system, the advantage of this are clear for both the patient, the ability to access care, and the provider, for the provider to maintain contact with patients, to provide all kinds of services over the telehealth system, and then for the healthcare system in general, keeping people out of hospitals and hospital emergency rooms and other places, using the telehealth system is clearly advantageous. I want to just say something about, very quickly about billing, that this is an evolving world, but there's increasing recognition now of this telehealth systems as legitimate ways to deal with patient care. Certainly now during the COVID emergency, but increasingly looking like some of those new payments that allow payment for telehealth mediated care is going to continue. The American Dental Association, what I'm looking at here, is their billing and interim guidance, which they're updating fairly regularly. So I'd advise you to take a look at that and get the latest information about what various commercial carriers are providing. They have all kinds of information about the what kind of codes are being paid for, even the teledentistry codes, and then the listing for each of the commercial carriers. And then at the last webinar, I don't want to take too much time today, but Dr. Seo showed this slide, which I borrowed from him, so thank you, Dr. Seo, of the situation in Hawaii, where right now during the COVID era, there's now commercial plans that are paying for the limited oral evaluation, the D0140 code, using synchronous or asynchronous depending on the carrier. And the Hawaii Medicaid system has already been paying for some of the oral evaluations and radiographic images done over telehealth. So we're seeing increasing recognition that this is legitimate care and is being paid for. So that sort of brings us to the idea of, in the future, this is not something that's going to go away. Many different practices are now beginning to think, you know what, this is really, for the long term, important to start thinking about this idea of a full all-in-one kind of telehealth system to be able to be an adjunct to the practice. And in fact, the American Dental Association, I thought was interesting. They came out with this return to work toolkit, which some of you may have seen. By the way, everything I've referred to the ADA is easily downloadable from their website. What was interesting, they had lots of really good information in this return to work toolkit, but there's nothing about telehealth in there. I've actually been in communication with them about that. I think it's really an omission. The reason it's an omission is on the next couple of slides, where we know that dentistry is one of the professions that fairly high risk for transmission of airborne infectious virus particles. This is looking at the risk of various professions. The blue ones are non-health, clearly lower than the healthcare professions, which are the green ones. But those three circles, that's dentistry. That's dentists, hygienists, and assistants. Really at the top end of risk. Hygienists are practically off the charts here. But the reason that they're in those categories is because of the production of aerosols. So I think we have to think very seriously about resuming practices. A lot of practices are just sort of opening up and going back to what they were doing before. I think that's really a dangerous mistake, and it's going to come back to haunt people when you start to see infection rates in dental offices by not paying a close attention to how high the transmission risk is when you're producing aerosols. So here's my prediction of dental practice in the future, really now and going forward for a long time to come. If you look at this chart, you can see the bottom is sort of the picture of the office with these highly modified operatories, someplace where you're going to do the aerosol producing procedures. Probably you're going to have to do some things to change those operatories. You're going to have the air in those operatories be somehow walled off from the air in the other operatories. Maybe some kind of airflow exchange that's going to be certainly at a higher level than most offices have now. Maybe the operatory is going to have to sit empty for 15, 20 minutes, half hour between patients. All these rules are not settled yet, but it's clear that you're going to have to do some things about the aerosol procedures. Now, maybe the office can have some things that don't produce aerosols, more moderate level of exposure, where you're doing more minimally invasive procedures. And this is where the importance of the stuff I talked about early on is the things about using minimally invasive procedures and preventive procedures and interim therapeutic restorations and fluoride varnish and silver diamine fluoride. All that stuff can be done without producing aerosols. Don't need as much modification of the operatory. But the critical thing here is to think about this top circle here. This is the telehealth system. So the offices that are really going to be able to thrive now and in the coming years are those that realize the potential for connecting to patients using telehealth. And that doesn't mean they even have to be out in schools or Head Start centers. This is just for pre and post visit care. You can do a lot of important things. All of the, again, talking, how are you doing? Are you having any problems? All that stuff can be done in a pre-visit video conference with the patient. All of the collection of data, all of the signing of consent forms, all the updating of the medical history, all that stuff can be done ahead of time so that when they do come into the office, and maybe some people in those, maybe there's some number of even just talking visits where people don't even really need to come into the office. And then those that do, it's a much quicker visit to the office, and you can even use that pre-visit to try and decide which people might be able to be kept healthy with more minimally invasive procedures. So I think this is going to be a very important part of dental practice going forward. And then as people get used to the idea of having telehealth as a part of the practice, then we can move to the idea of incorporating the community. So you have your office practice where you're using telehealth, but now you can connect to the community where you might have part of your team going out into the schools or local business and or a community center and seeing people in your community. So the idea of telehealth is a part of the practice, not separate from it. The idea of maybe being able to connect, initially just facilitating in-office care, but then later on connecting to community. The idea of these workflows where you can actually facilitate people's care and keep the number of people coming in to the office to a lower number and make those in-office visits much more efficient. The idea of an all-in-one system, the idea of emphasizing these minimally invasive procedures, all of that's going to get us more towards a system that's going to produce more health for more people, really good for everyone. Practices are going to be busier, they're going to have more people. With half the population not getting care or more, there's a lot of room for practices to grow by engaging those people who are not traditionally getting care. So let's talk a little bit about now adoption of that. And so the rest of the time, what I'm going to do now is make you aware of something that we've been working on. And actually, there'll be an invitation for you. If you're interested in joining this project, you'll have the opportunity to do so. So we're working with a company. It's a company called Virtual Dental Care that has a product called the Teledentistry Communicator. It's a software package that was designed specifically for teledentistry. And what we're doing is we're starting actually a demonstration project where we want to be able to show that offices that use this system can actually do a better job of keeping in touch with their patients. It's a full service system that has all the components that we talked about earlier. There's a short, if you want to look at a 2-minute video on YouTube, you can just search for Teledentistry Communicator. You'll see the little overview video. These are just some screenshots from the video. But it's a pretty sophisticated system, as I say, designed for now the current world that we're in. It's got the ability to, people can use it. I mean, talking about the practitioner and the patients on a computer, on a tablet, on a cell phone. There is a secure online streaming, so you're not using something like Zoom, which may or may not be secure. You've all heard about Zoom bombing and people joining or getting into video comms. This is a very sophisticated, very secure video system if you're using that. It's got the ability to have patient scheduling, so the office can set up a schedule. The patient can actually choose their time for their video comments or their interaction with the office or the dentist. You can have patients that make different kinds of appointments themselves. The office sets up the schedule. The patient makes their own appointment. Pretty easy to use by patients. easy to use, access by the provider so they can see who's got appointments coming up and integrate it into their office flow. A listing of your patients. You can have patients there. You can have the full patient records of everything that happened during the communicator, teledentist communicator interactions, all the records the patient posted, anything that you did, or the video conference itself. You could actually make have a record of, you can see here, there's all the tabs here for patient information, medical history, treatment, general progress, prescriptions, a ledger if you're charging them. Now, this is not going to substitute for your electronic dental record system, and we'll talk about that in a minute, but it really is an add-on to what you're doing in your office that's collecting some records about what's done through the telehealth system. And then referrals, you can have a network, so you can have as many of your colleagues, physicians, dentists, other people who you want to be able to maybe refer patients to, or have someone take a look at their records for a consultation. All that stuff can be added into the system. Patients get appointment reminders when they have an appointment coming up, and it's all configurable by the office, so they can set it up so that use forms that they want to use, and it works for the office. So that's the system we're going to be testing. And the way the testing is going to work is that we're going to be able to provide, the company is going to provide a discounted rate. They normally charge $150 per dentist per month, a discounted rate for people who participate in this test. It's going to be valid, that discounted rate, as long as people are participating in the demonstration. And what participating in a demonstration is, it really means just a commitment to use the system and to provide some data about how you're using it. So some of the data will just come automatically from the vendor, how many times did you use it and how many video conferences, but we want the providers, we're going to ask providers for some data about their satisfaction with it. We were able to bill for the visits. No patient data will be shared whatsoever, but just kind of usage data. And then all of this can be linked into your electronic dental record system. We don't live in an interoperable world now. So I'm going to ask this question because I know somebody will later, so I'll just try and answer it now. But we can go back at it again in a couple of minutes if you want. We don't live in an interoperable world now, so there aren't any teledentistry systems that are fully integrated with office systems. But it's certainly fairly simple to think about. Use this system for stuff that you do with over teledentistry and patients in the community. It's easy in your regular electronic dental record system, just in your progress notes. Put in just the minimum information you need for billing, and put it in a Notehead video conference system or a teledentix system. Put in a link, which is just a copy of the URL, put in a link, and the next time you want to go back to that record, you click on the link and it'll open up the teledentix system and you take a look at the patient's records. So it's not a full integration, but fairly reasonable facsimile of integration. So the next steps, if there are people who are interested in participating in that demonstration, are first of all, decide that you want to do that. We're happy to answer some questions now, and then if people want to actually more detailed questions or an individual one-on-one, we're happy to arrange for something like that. We're going to do a post-webinar survey after the webinar is over, and be able to have you let us know if you want to have more information or individual questions. And then for people who do make an agreement and sign up, there'll be an individual software sign-up session where you get all the orientation and configuration by the virtual dental care company. And then in my role, who's conducting this demonstration project at California North State University, will be responsible for helping you integrate all the workflow and data collection, and then facilitate a peer learning system. So Mark, I think we had the second poll, the last poll for this webinar. Maybe we can put that up now. So if people would just take a minute now that we're towards the end of the webinar, just make some indication. Nobody's going to hold you to whatever you say, but just what is your feeling right at this moment about what you think your future use of teledentistry will be? The four choices are: I probably won't make any use of teledentistry, or I might try to use teledentistry a little, or I think I'm going to actually make some use of teledentistry. Seems like this is actually worth doing. Or I think this sounds like a lot worth doing. I think I'm going to make a lot of use of teledentistry. So if you would just click on one of those four choices, hit the submit button so you can submit your answer. We'll be able to collect the data in a minute. Again, no one's going to hold you to whatever your response is here. But the third question you're going to get will be a question you'll get afterwards, which will be the poll or the survey, post-webinar survey, where you'll actually be able to let us know if you want to find out more about the demonstration project or even be a part of it. So if everyone's had a chance to fill out the poll, we can close that now, and if, Maki, you do get some results that you can put up like you did before, that would be lovely. There we go. So, well, you can see a pretty dramatic shift from the way it was an hour ago, that nobody said they won't make any use of teledentistry. So obviously everyone who's in that category initially has shifted there. This thing might have some potential. About a third said they're going to try to make some use of it. And then really it's more than half, almost 2/3 have said either make some or a lot of use of teledentistry. So clearly people are understanding, as the industry is in general, this could actually be a really important tool for facilitating, if nothing else, even just facilitating regular office practice by being able to use it for just for pre and post office work, even if you don't get to the degree of doing what's the demonstrations of the virtual dental home. Even if you don't do that, a big adjunct for clinical practice and actually even office-based practice. And so with that, I think we've come to the end of the slides, and I think I will stop the slideshow now, and we can move to the time where I think Nicole is going to be looking at there's both the chat and there's the question and answer box. So if you have questions, go ahead and put them in the question and answer box. I can see some of them, and Nicole may help me by reading off some of them. So I see the first one of what is peer learning. So while other people are typing in their questions, I will respond to that one. So what we mean by peer learning is that we're going to have a way, we haven't figured out all the details yet, but we're going to have a way for everyone who's involved in this demonstration to sort of share their experiences with other people. Some of them just may be sort of periodic polls. How's it going? What are you running into? What's working? What's not working? And maybe letting other people in the demonstration know about that. Or we may even have some. We'll probably do it by location. So we'll probably do it. If we have enough people in Hawaii, sort of Hawaii specific, maybe like a Zoom session where people who are using the system can just get on and share experiences with each other. Hey, I figured out if I do this, it really works better than if I did that. So that's what we mean by we're going to facilitate some kind of peer learning as we go through this demonstration, so people who are using it can actually learn from each other. That's the only question that I see that was typed into the question and answer box right now. So if other people have questions, this is the time to post them. Good question. How do we educate patients on how to use this? Thank you. Well, so that's actually going to be one of the things that would be important to think about. And when I talked earlier about, we have some ideas to help you integrate this into your workflows. So, what other people are starting to do now is, first of all, just to notify patients in general, just to notify patients such a thing is available. And that can happen in multiple ways. So it could happen where you just, if you have patients' email address, send them all your patients an email saying, we have the system available. And, we'd be happy to stay in touch with you. If you've got questions or concerns, we have a way of actually setting up a real-time secure video conference with you, or even looking at a picture you took of your own mouth and giving you some advice. So here's how you do it. And it'll just be a link to a system. You can put a link if your office has a web page, you can actually put a link on the office web page. And then, we can think, and maybe Dr. Tse might help us, or the Dental Society might even think about if you have a referral service. So maybe the Dental Society referral service might even put a link there, or someone calls the referral service, might be able to refer them to a dentist who's actually using the system. So someone doesn't want to go to an office, but they want to talk to a dentist. Well, here's a group of dentists. Here's a list of dentists in your area who are actually using a system like this, where you can get some advice and contact with them without a trip to the office, at least not initially. The first pass would be through telehealth. So that's kind of, I call that notification. And then I'm assuming the question is even a step beyond that. How do we educate patients on how to use it? So for patients, it's relatively simple, although some people might need to be coached through the actual technical, here's what you do with your phone, and you push this button. And that can be done, maybe someone in the office can help walk the patient through getting connected. There are some patients who may have more or less difficulty even signing up. Maybe the office can help to sign them up so they don't have to sign up themselves if people have trouble doing that. Another thing that might fall into educating patients on how to use it, there are some very nice things that various dentists have put together about how patients can take pictures of their own mouth, just how they do cheek retraction. It's always better if you have a two-person team, the patient and somebody who's living with them. The patient can actually use, I don't have it readily available to show you, but one dentist put together really a very nice picture of how to use just a very clean, like table knife, so it's not sharp, but just a reflection of that. We can retract the cheek very nicely, and you can get a nice side view of the teeth. Using like a makeup mirror, can get the full art shots. I'm using a spoon for retraction. So there's all kinds of sort of nifty little things and instructions for patients that can be made available. We'll have all that stuff available for people in the demonstration to help patients figure out how to take some pictures of their own mouth. You know, what we find is a lot of dentists sort of started this idea, okay, I've got to do something for my patients. Let me get onto Zoom with them. And it's really hard to see very well with a patient who's got their cell phone in front of their mouth and you're trying to look in while they're holding their cell phone. First of all, patients it's hard to hold still. They typically don't do it in good lighting. You really can't see nearly as well as if you coach the patient through actually taking some good photographs, good lighting, good retraction. And so there's, you know, again, we'll have some educational materials for patients on how to set up the photograph. So you start with that. You might still want to have the real-time video conference because then you can talk to the patient and, you know, maybe even look again at something that they sent you, but you're getting better pictures with the still pictures. So I hope that answers the questions. There's just a lot of different things that we can do to help patients learn how to use a system and be a partner on the other side of it. I see another question, which is there a limit to number of study participants? At this point, we don't think there's going to be a limit. So it may be that I don't think there'll be a limit certainly initially. If you know, we think that it's going to kind of trickle in. Actually, is what we're expecting. It could be that if we get overwhelmed in a month or two, but I don't think any of you need to worry about that. When you get you don't have to be the first on the block to sign up to be part of the demonstration. So if you when you get the post webinar survey and you're interested in being a part of it, fill out whether you want to just sort of sign up or have some more questions or a one-on-one, whatever you want to do, and we'll get back in touch with you. And maybe over the next couple of weeks we'll help you decide if you want to be part of it. And there won't be any problem being a part of the study if you decide probably in the next month, probably in the next several months. I don't see any problem of people being able to be a part of it. Those are all the questions I see in the question box right now.
There's
Go ahead,
a
Ed.
question in the chat box from
okay.
Dr. Kim, if you can take a look at that.
I see it. I saw one advertised teledentistry that was having patients purchase a cheap intraoral camera. Thoughts on that? It's possible. There are some intraoral cameras that are pretty cheap and pretty and take good pictures, but there's a real learning curve. We found that in all the virtual dental home systems that we've been doing, where you have the team of the hygienist and the assistant are going out into the community, and they're taking a full set of photographs and X-rays and a lot more stuff than the patient would be doing. There's a real learning curve to using the camera, and so patients are not going to be able to get it focused and stuff unless they just happen to naturally be good at it. Most patients will have a lot of trouble doing it. They're not. When it says that they're low cost, they're not actually that low cost. They're like $200 or $300. I mean, when they first came out with intraoral cameras, they were thousands of dollars. So $200 or $300 is pretty low cost, but for a camera that's going to take any kind of reasonable pictures, you're still talking about several $100s. I'm not telling anybody not to do it, but it seems to me it's got sort of limited utility in a system like that, where you're going to have to train patients and count on them taking the pictures without somebody being there with them. I see another a question in the question and answer. Is it possible to only use portions of the system? Well, the demonstration is going to be using the system. The system, it doesn't come apart. You can't say, I'm going to use this part and not, I'm only going to do video comments and I'm not going to have the part where people can upload photo. You'll get the whole, if you're participating, you'll get the whole thing. You don't have to use it all, but you'll get the whole thing. So yes, it's possible to use portions of it, but it's still the same subscription, the same demonstration, the same sign up. All that part will be the same. You can choose which portions of it you decide to use once you have it, but you'll get the whole capacity. I'd say, just to be clear about this, is a system that this company makes a full service system, really usable in a virtual dental home, where you're collecting X-rays and you're collecting full intraoral photographs and charting. What we're talking about here for this demonstration does not include those pieces. This is really for facilitating the patient to the practice interaction, so it doesn't include the X-ray capture and you could upgrade to get that if you wanted to. If you like the idea of this and wanted to start sending your hygienist out, you can do that. But the Teledentix communicators product that we're going to use for this demonstration does not have the X-ray imaging, all the imaging capture except for what the patient can upload in the real-time video conference. But you get the whole thing if you're participating. Don't see any other questions. Here, so Andrew, oh, go ahead.
No, I said one more just popped up, Dr. Glassman.
Okay. Oh, I see it. Yeah. Will there be any cost to participants other than the equipment? The cost is the subscription. So as I said earlier, it's a discounted subscription. They're normally charging $150 a month per dentist, and this is going to be for $100 a month per dentist. It's a discounted fee. It's actually not really very expensive. If you use it once or twice, you would pay for it during the month. So everyone has to make that decision themselves whether you consider that to be fairly reasonable cost. I think it's pretty reasonable. So if you're using the subscription, $100 a month, there really is no need to buy any other equipment. The patient can do the video conference on their own computer at home, on their cell phone. They can take photographs to upload to you on the photograph. It's all web-based, so you don't have to buy anything. You don't have to install any software on your computer. You don't need any special equipment to use it. So really the only cost, I mean, you could buy other stuff. Like the question was just up, could you buy the patient a special intraoral camera? Sure you could, but you don't need to. So really the only cost that's involved here is just the monthly subscription, which again is a discounted fee of $100 per month.
Great.
Well, as I say, I think we're...
Sorry, I was going to say, if there's not any other questions, kind of final call, we'll go ahead and round off the webinar. Any other final questions for Dr. Glassman?
No, and I'll just say, thank you to all of you who joined. It's great to see more than 50 people who have come together to listen to this and think about it. It was interesting to see, but it was what I expected, that the sort of change in the polling question from the beginning towards the end of people are really starting to get the idea, and not just in this webinar, that teledentistry is going to be, I think, a really important part of dental practice in the future. I think those practices that learn how to use it and embrace it are going to have a much easier time in the coming months and years of having a really robust practice, staying in touch with patients, not being quite so affected by all of the new infection control and spread of infection concerns that are going to take place as the dental industry begins to emerge from the emergency situation. So I think this is a group of pretty forward-looking, smart people thinking about that and how do you begin to incorporate this in your practices. And I hope that some of you are interested in being part of the demonstration project, and to the extent that you are, look forward to work with you. So I want to thank also Dr. Seo for a long time association now. The Hawaii Department of Health has been a spectacular partner and great to work with, as have the dental staff at West Hawaii Community Health Center and HNKOP on Maui. And then thank you, Nicole and Maka, for your help in setting up the webinar and making it work.
Great. Thank you, Dr. Glassman. We are just so appreciative of you taking your time and sharing your knowledge with us today. And thank you for everyone who attended this webinar. We will send a link with the webinar video and also for that survey within the next 48 hours, and then expect within the week to receive your CE certificate as well. So thank you and have a wonderful evening.
Thanks, everybody.